Hey, so for the final presentation, I'm going to talk about the anxious patient. So my name's Dr. Lizzie Croton. I'm a GP in the Midlands, close to Birmingham. And for the last couple of weeks during this very strange time, we have been consulting via telephone and video, so remotely. This is a presentation looking at video consultations, but is also applicable to using the phone as well. So let's start with an approach. As I said before, this is a really common scenario at the moment. Everyone's anxiety is heightened because of the pandemic, and I think patients who are experiencing anxiety are incredibly common. We'll start off with the basics by basically making sure that you've got the right patient and confidentiality, and we talked a little bit about this in the previous presentations, which you can find on the website. And I think we all know from talking to a patient when they're anxious, there's lots of clues in the body language and how people speak. They may appear tense if you're looking at them on the video. They may be moving around. They may have very tight shoulders up by their ears. Their voice might be shrill. This is more common in the female sex, and they may be speaking very fast. They may be changing topics. They may be quick to respond, and their cognitions may suggest anxiety. They may have catastrophic thinking, all or nothing thinking, the typical CBT type thinking groups that we hear about. And this is really very, very common, and what we'll see. Again, when talking to patients with, who are experiencing anxiety, um, the basics are really important. Listening to the story, introducing yourself, um, asking what brings them here and what are they looking for. Um, the old ideas, concerns, and expectations, which I'm sure we're all familiar with. Why have they consulted now? They may tell you directly that they're feeling anxious, or they may express directly what they're looking for. You may need to read between the lines. So it might be a typical scenario that I've certainly experienced over the past few weeks. Have been patients who've been ringing up wanting a sick note because they're too anxious to go into work. Some of the frontline staff are finding this very difficult at the moment. And they may not directly say that, but they may talk about how anxious they are, and they may be hoping that you are going to say, well, let's look at this. Are you looking for a particular, are you looking for a note? Is it that you feel that you can't go into work? So you may well need to read between the lines when they're talking to you. The second thing, or the third thing rather, is it something that you can help with directly? At the moment, there is so much information all over the place. It's changing daily, hourly. It's really difficult to keep up to date with it. And a lot of people are becoming very, very confused and not really knowing who to turn to. So GPs are getting a lot of requests for employment advice. They're getting requests for letters for employment. They're getting requests about furloughing, believe it or not, and all sorts of things, because the GP is somebody consistent, and the patients are asking everything really, because that's kind of what people do when they're feeling anxious. So is it something that you can help with? Sure, we can listen, and we can help people uh, organise their thoughts and provide supportive care, and that's part of our role. But if it's not something that we can directly help with, if we can't, who can? And that may well involve signposting. It may involve signposting people back to their employer. It may involve signposting people to the NHS website, or to the government website, or to various other websites. So it's a good idea to have an idea of where you can signpost people. At the moment, a lot of the Facebook groups for GPs are talking about these scenarios and what they've done, so that may well be a good thing to have a look at, as well as the daily, hourly um, bulletins that we get from all sources at the moment. I think a lot of people are working this out for themselves, and things are changing so often that usually, if you don't have the answer, somebody else will have dealt with it. So it's becoming easier to find the answer, and of course colleagues as well. And it's perfectly acceptable to say, well, I'm not sure, I'll find out, or I'll have a think about it and come back to you. It may well be that the patient just needs a supportive chat. If it's not a clear medical issue, or not something that you can provide immediate support with, it may well be that you need to have a chat with them and see if you can support them that way. And we'll go on to a technique for doing this in the next slide. So this is a fabulous technique which many of you may have heard of. It comes from the 15-minute hour, efficient and effective patient-centered consultation skills. And it's called the bathe technique. I would really recommend reading this book. It's full of interesting and useful techniques and approaches that you can use within the time constraints of a general practice consultation. So let's move on to the bathe technique, which is a really nice acronym, a series of questions that you can ask patients, and it helps them articulate the problem to themselves so they can hear it, but also fosters a sense of connection. And I've put the questions down on this slide. So the thing to ask is, first of all, the B is background, what's going on in your life. Affect, how do you feel about that? Trouble, what troubles you the most? How are you handling that? And empathy, that must be very difficult. So you may, for example, ask a patient, what's going on in your life? And they may say, well, I'm worried that I might lose my job. And they may say, well, you may say, well, how do you feel about that? And they may say, well, I'd be devastated. I don't know how I'd cope. And what troubles you the most? Well, I'm worried I won't be able to pay my mortgage. Yeah, I mean, that sounds difficult. How are you handling that? Well, it's hard, but I've got the support of my family and friends, and I suspect we'll get through it. And then finally, the empathy, that must be really difficult. We're here for you. Let us know if you need any more support, that kind of thing. So it's a really nice technique. I recommend you find your own ways of phrasing the questions, but it's a good way of trying to conceptualise a problem. And it's one of the many techniques in the book which is well worth having a look at. Can't recommend this book highly enough. So finally, a little bit about housekeeping. Emotions can be contagious, and particularly if you are feeling more anxious yourself, which I think all of us are feeling changes in our emotional state over the past few weeks. It can be quite, I suppose, if you are consulting with a lot of patients who are experiencing anxiety, it can certainly affect your own anxiety. And so it's important to check your own state. How are you feeling? It's perfectly okay to take breaks and just take time out and have a cup of tea, or go for a walk, hopefully not too many times a day, ideally just once a day, but maybe a walk out around the building. When you're talking to patients, if you are in a reasonably calm state, or if you're not particularly calm but you're able to fake it for a little bit, that can work. That actually helps them to calm down as well. So just looking at your voice, looking at the tone of your voice, using calming phrases yourself, that can help the patient calm down, which makes the consultation flow easier. Talk to colleagues. You can, if consultations are becoming too intense, find ways to have breaks from them. It might be that you tell the patient that you'll ring them back, or you'll deal with something else, or you'll find something else to do, or take another call. That's perfectly acceptable, so long as the patient isn't expressing suicidal ideation or very unwell. It is perfectly acceptable to have a break if it is getting a bit intense, and have a think about it and ring the patient back. I put down a YouTube link for Mark Williams, Professor Mark Williams from the University of Oxford, as 3-minute breathing space audio, which is absolutely fabulous. It's a mindfulness-based technique which lasts 3 minutes, which isn't long at all. It's also worth having a look at the resources available for doctors and healthcare professionals at the moment. I believe that the Calm app and the Headspace app are offering free NHS membership till the end of the year. And if you are a doctor or dentist in the practitioner health programme also has a lot of resources on it as well, which are worth looking at. So be kind to yourself. We will get through this, and it will undoubtedly change general practice in many ways. And I think it's absolutely fabulous how resourceful and resilient the service is, in the sense that we've managed to change our practice in a couple of weeks to see patients remotely. I think that's a real testament to the strength and the skill of general practice and the wider NHS. I think it's really humbling time, and we need to look after each other and the patients, and keep going until this is over. So I hope that was useful, and please stay safe and look after yourselves.